People take vision for granted sometimes until they have a problem, and we realize how important the sense of sight is in quality of life for individuals. You know, medicine is becoming more and more specialized. We can now cure diseases and advance the care of diseases that 20 years ago, 30 years ago, we had no treatments for. So the new Eye Institute is slated to open in December 2026, January 2027. Being downtown will also allow us to be in close proximity to this area that had been previously underserved with regard to ophthalmologic care. We'll be serving our local community, but we actually serve a 5-state area. We are going to provide all the clinical eye services for all ocular diseases and routine eye care. What's going to be a little bit different about where we'll be then versus our eye center on the 6th floor of Janeway Tower is that we're going to have our own ophthalmology-specific operating rooms. So we will have the synergies of having basic science ophthalmology research right near where we are doing our clinical research and our clinical care. And that's the best way really to move forward finding new cures for eye diseases. Without philanthropic support, the Eye Institute would be still a concept. It's when you connect your passion for something that is really great and making the world a better place with people who have the means to support philanthropic endeavors, and they grab onto your mission and they say, yeah, we don't want those people going blind. Yeah, we want to prevent blindness in those folks. That's an amazingly beautiful thing. I often tell people I have the greatest job in the world, and I feel like I do. Because of their philanthropic investment in this, we want to give the people in the communities that we serve the best opportunity to have the best vision or the best quality of life, and I am incredibly grateful.
My name is Natalie DeRoche. I'm a fourth-year medical student at Wake Forest University School of Medicine, and for the past 2 years, I've been the co-executive director of the DEAC Clinic. So the DEAC Clinic is a student-run free clinic, which means the students are staffing it, we're organizing it, we're calling all the patients, and we are supervised by physicians, PAs, and nurse practitioners within the Winston-Salem community. We serve all patients who do not have insurance, and we try to help them get access to not only primary care, but also specialty care. So we're kind of unique in that we also offer these specialty services that's not available for most people without insurance. That means we give people access to dermatologists. We're able to get their skin checks, things biopsied. We have a cardiology night where people who might have advanced conditions like heart failure or other things that are difficult to manage within a primary care setting are able to be seen at our clinic free of charge. We just started, this is one of my babies, my projects, we started a hygiene pantry. We had a patient that shared that her and her 4 children all use the same toothbrush because they weren't able to afford toothbrushes because it's not covered under any government insurance. And so hearing different stories like our patients, we realized that that's something we need to be addressing. And so we started a hygiene pantry that gives away shampoo, conditioner, soap, toothbrushes, menstrual products, different things like that. And I just love that story because that's one of our goals, is to make this a really open environment where people don't feel like they need to be ashamed for not being able to access the care that they need. So the DEAC Clinic very much relies on donations to be able to operate. We have partnerships within the community that helps us to be able to do this, but we very much rely on private donors. In a wonderful situation in which our funding increases, the options would just continue to expand on what we could provide, and that would really be community driven on what we see the needs in our community as. And so all the support that we have really makes a direct impact on what we're able to provide for our patients and kind of the greater impact we can have on public health within Winston-Salem.
So I'm Suresh Isparami. I'm the chair of urology here at Wake Forest University School of Medicine. I've really gotten interested in urology initially because of the long-standing relationships doctors can have with their patients in the field. While maintaining the highest level of patient care, we really want to expand patient access. And that's not only to patients in the immediate Winston-Salem area, but in all the regions that our Wake market accesses and treats. And this is in a vast array of urologic care, including kidney stones, benign prostate enlargement, various urologic and genitourinary cancers we treat, as well as female pelvic health and infertility as well. We're expanding our clinical service line with an intentional effort to increase the number of clinical urologists, our advanced practice providers, meaning our nurse practitioners and physician assistants, as well as our training programs. In doing so, we're also investing in the various technologies to really bring the most advanced technologies and surgical care to the patients we serve. We have been very blessed by very generous donors who have given towards endowed funds to support our research programs, but also our educational programs. So that has really bolstered the opportunity to have the highest level of our resident and fellow trainees, many of whom during their training period are doing research concurrent with their clinical training and have opportunities to really shine and present their work and findings and innovation at regional, national, and even international conferences. Your support to fund cutting-edge research, the highest level education programs, and advancing our clinical care is what is going to lead Wake Forest Department of Urology to bring the highest level service and care for patients not only in our region, nationally and globally, and be recognized as a leader in this discipline.
Thank you so much for your support. Everything that you are doing helps our community to be healthier, and we are so grateful for it all.
It really is the fuel that allows us to provide the highest level care.
Every donation is life-changing. I just can't really express how grateful I am to all of the donors.
Thank you all for this.